You're watching West Hartford Community Television.
You're watching West Hartford Community Television.
You're watching West Hartford Community Television.
For the community, by the community.
Welcome to our October show. We have some great things in store tonight for you and some fabulous guests. And what are we in now? We are in fall. I'm thinking apples and leaves and crisp air and pumpkins.
Halloween's
and
coming.
Sweaters and boots. Yes. Cover up.
Mario, do you have your Halloween costume ready?
Yes, I do.
You want to share it with us?
Yes, it's going to be a Bavarian guy carry me mascot.
I have no idea.
What does that mean? What's that?
It's
like
like
a donut Bavarian cream?
It's like a little mascot underneath you, like pretend it's carrying you.
Oh, that's cool. So there's a person underneath you, or that's the costume?
Pretty much it looks like
That's
it.
the costume, and then
That's
it looks
the
like it's
costume.
carrying
And your head's like coming out of it.
No, actually, my whole body is like,
So you're like
it's like a piggyback. It's like you're on top
like a
of
hunchback
someone's
person.
shoulders.
Hysterical. And then do you have like 2 steins of beers or something that you're
Yeah,
holding?
pretend I'm like kind of drunk or something.
Did you make this, Mario? Or
No, you can buy it.
oh, okay, nice. Guess we'll have to step up our game, ladies.
Yes, I know. Got to compete
I've
with
never
that.
heard of that
Very
before.
creative.
Yes.
Excellent.
So we have a lot of pink on our show tonight.
Yes.
We do.
We're all pinked out.
We're all pinked out
Shades of
for
pink.
October, along with all these other hot fall things that we have. It's Breast Cancer Awareness Month. And as you can see, we're all in our pink. We're all in our pink. And we're dedicating the show to bring awareness.
Yep, to bring awareness to this epidemic, which is facing our country. So this is what our show is going to be all about tonight.
Pink, yeah.
Yep.
And I mean, really,
Breast cancer awareness.
We've done a lot of research on this. I mean, and we have wonderful guests tonight that are going to talk more about it, but the statistics are truly startling.
Yeah.
I mean, I think it's 1 in 8 women in the United States will develop invasive breast cancer during their lifetime. It's the most common cancer among American women, except for skin cancers. But we've had amazing improvements throughout the years. Medical research has done wonderful things for it. I mean, you can't really, I think everybody knows somebody who's
That's
been
what I was going to
affected.
say. I'll bet
right?
you all of us know somebody who has had breast cancer.
My aunt is
Gone
her
through
second
it.
time. I mean,
Yep.
we're all kind of honoring women that we know and men who have been through this.
Yeah.
Like our friend, Cammie.
Yeah. Woo. So I just finished my last dose of
Yay.
radiation.
Cheers.
Congratulations.
Cheers.
Cheers.
And I actually was pretty lucky, I think, because my cancer was non-invasive and it was caught on a routine mammogram. And so I encourage and I continue to encourage ladies to keep up with your yearly mammograms. It is
That's
so
so
important.
Yep.
You know, I talked to a couple of ladies at work recently and they said, oh gosh, you know, it's been a couple of years and I just forget. And to me, it's just a lifesaver. Like
Yeah,
to
it's
me,
so easy.
You know, and it was caught so early, so early, like the earliest stage possible.
That's so good.
And they treat it just like cancer now, my form of breast cancer. So I had a couple of options, and I opted to do radiation and lumpectomy. So I was diagnosed in March of this year, and as you girls know, and threw me some pink parties and came to my house and cheered me up. But you know, after I got past that, really it's all about attitude, honestly. And the circle, and you know, they talk about a tribe of women, and they just really encompass you, and they bring you in and you educate yourself, and you know, the facilities around you, there's so much support, honestly. And I feel lucky. I honestly do. Yeah. I feel really lucky and blessed that it was caught so early. You know, I went through some painful biopsies, some little rod procedures. The radiation really wasn't too bad, but you know, everybody goes through their journey. And I'm glad that mine is coming to an end, and I will begin some medicine to keep me on track and try to live a healthier lifestyle.
How many months of the radiation therapy did you have?
So I did 20 rounds, and there's some boosts in there, and Dr. Birch, who we have on tonight, will talk a little bit more about that therapy.
But it was every day.
It was every day, Monday through Friday. Right, and I went through a lovely facility through Hartford, the Helen and Harry Gray Cancer Center, and I was lucky enough to go to Avon, so I didn't even have to go through to Hartford.
And like you said, your attitude is so important. Your attitude was so phenomenal.
Honestly, right.
It was unbelievable.
Yeah.
You continued to work out. You continued to do everything you do. You continued
and like I said, I looked at it as, you know, it's just something I have to go through, and it was caught early. I'm not going to die.
But can I ask you a question? So do you think if you did not have that screening and you went and you let a year lapse,
right?
It would have been more further advanced.
I do, because a couple of the radiologists at the hospital said it's kind of like a sneaky type of cancer. It can kind of move and grow, and that's why they did extra biopsies on me. But yeah, absolutely. Yeah.
So thank God. So we're gonna, in a few minutes, I think
prevention.
we're gonna have on your doctor.
Yes. I am so
Looking forward
privileged.
to talking to her.
Yes.
Yes. So we're gonna have
bring
on
her
Dr.
on.
Birch.
Yeah.
Great.
Great.
Thank you. So welcome back. I am just so thrilled and personally honored, humbled to have with us tonight Dr. Helene Birch. She is a radiation oncologist. She was my radiation oncologist, and she was amazing and made the whole experience just so much better. She is affiliated with multiple hospitals in the area, including Hartford Hospital, and an assistant clinical professor at the University of Connecticut. She is here tonight to share some valuable insight with the importance of early diagnosis, share some ideas and facts, and treatments. And so, welcome, Dr. Birch.
Thanks.
Welcome.
Dr.
Thank you
Thank
for
you,
being
ladies.
here.
Hi, doctor.
Thanks for having me. Hi. 1% of all breast cancer is male breast cancer. So.
Wow, I know, and that's I feel like it's even more because there's a few people that we know.
You hear about it a lot more.
Yes,
Positive mind, yeah.
Yep. For every 100 women, there's one man with breast cancer.
Okay.
And is it more women are being diagnosed earlier, or are we just hearing about it more?
Right.
I think we're hearing about it more. It's pretty stable, the number of women who develop breast cancer. So it's about 285,000 women each year in the United States develop breast cancer. And most of those women are surviving. There's only 40,000 women a year who die. So the number of survivors of women with breast cancer is...
And those are the numbers since when? Like, when are we talking about?
That is from the American Cancer Society 2016. Those are the numbers that they publish. Every year they have their cancer facts and figures, so that's where you can find the most up-to-date numbers.
So more women are surviving because there's better treatment, earlier diagnosis.
Correct, both. Yep.
And why, Dr. Birch, would you say, I've heard that Connecticut is the #1 state for breast cancer?
Yeah, Connecticut and New York. I think it's just a combination of the genetic factors for the people who live here, plus those were the earliest settlements when people came here. So, but no one knows for sure. They've been doing studies, but those are the numbers. They don't really know why.
Okay.
When you say genetic factors, like what genetic factors would predispose you or have an influence
Well,
on whether
now people can freely travel and marry people far away, but you can imagine when you settled and you didn't have cars and buses and trains, you kind of married people who were close to you, and so the risk of inbreeding of genetic factors.
Okay.
Wow.
You sure there's nothing in the water we're drinking?
There could be.
I mean,
know
and
a
then
lot
the
about
plastic
that, too.
bottles, too. I mean,
Yeah.
there's so many different...
Yeah, nobody really knows.
And so you work closely, I know for myself, my surgeon was Dr. Gates with the Hartford group. And then I had, so it was surgery, and then it was treatment with you and your group, and then the oncologist, Dr. DeFusco, which is the hormone blocking pill, right? So is that how you kind of, well, you go at every patient differently, right, obviously.
Most women with breast cancer will have a team, and that team includes the radiation oncologist, the medical oncologist, and the surgeon. And most people have a doctor from each of those disciplines to help them decide what the best treatment for them is. So you look at different factors to decide the treatment. We call those prognostic factors. They predict how women will do. So the age, the size of the tumor, the grade of the tumor, the lymph node status, and then the specific factors about their tumor, whether it's estrogen positive, progesterone positive, and something called HER2/neu. So we can look at all those information about the patient and the tumor and then decide the treatment.
And is it like more common for women over the age of like 40 or 30 to develop breast cancer? You don't hear about a lot of young women.
Young women can get breast cancer, but 60 and older is the most common time.
60.
Wow.
60
But
and
yet
older.
we start receiving materials in the mail when you hit 40 for
the
mammograms.
the
Right,
yearly.
so 35 is your baseline, and then 40 you start every year. Some American Cancer Society differs from some other societies. Some say you can do it every year between 40 and 50, and then every year after 50, but I usually recommend every year starting at age 40.
Because like if you miss, like Cammie was saying, if you miss a year, it
So-
could have potential like disastrous,
Well, it's mostly slow growing, but women, when they're younger, their breasts are more dense. So at least for Connecticut, for women who have dense breasts, they give them category 1, 2, 3, and 4. So if you're in the higher categories, 3 or 4, they recommend a screening breast ultrasound.
every year.
Every year.
Following the mammogram.
Following the mammogram, yep.
Now, Dr. Birch, for males,
Yeah, it's amazing.
what's the percentage for us?
So there's no screening test for males. Usually they present having felt a mass and they go to the surgeon to have it biopsied.
Is there symptoms for males? Or-
So it's usually just a mass. They feel a mass, usually in the breast. And they do tend to present at a little higher stage. There's no...
They're probably not thinking, anything of
Maybe
breast
that's why.
self-exams or anything like that.
Exactly.
from a male as
I
opposed
don't
to
usually
us.
think of that either.
No.
No, I
Right.
don't think
No.
most men
Right.
probably don't.
Right.
And Dr. Birch, can you talk a little bit about, so when I went through, and I know a lot of women do the hereditary factor, so the genetics testing to see if you're BRCA1, right? Is it BRCA1? BRCA1.
Yep.
And so I felt like I won the lotto when it came back and said, you're not BRCA1 positive, but 15% is breast cancer, but the rest is just spontaneous.
Right.
that-
So most women don't have a family history of breast cancer. About 70% are just sporadic with no family history. If you do have a family history, you're at higher risk of having the breast cancer gene. So we say BRCA, it stands for BRCA, for breast cancer. And there's 2 genes, 1 and 2. So those are the most common genes. So women who meet criteria to have testing, so either they have a strong family history or a very young age presenting, they'll test for those different mutations, but there's a panel of other mutations that people can have. And we know that there are mutations that people get, but they don't know the significance of it. So some women will have genetic testing and it'll have a mutation and it'll say genetic mutation of unknown significance. And so they have a database of those women. So maybe 10 years from now, they'll know what those genes do and have some more information. We're still really early on that, the knowledge base for genetic testing.
So as far as like your children too, it doesn't matter whether or not it's your mother or father that had breast cancer. What is the effect there? I mean, is there any difference?
No, in terms of you look at the family. So sometimes a whole side of the family will have a lot of people with breast cancer. So then you think you may have inherited that gene from that side of the family.
Okay. And like, what can women do? I know you can't prevent a gene if it's in you, but what can we do, women, to sort of
well, you
limit
can,
the
possibility,
thank you, that we
so
would
if
develop.
you do have the breast cancer gene, women can opt to have bilateral mastectomy to reduce their risk of having breast cancer. So if you have the gene, it's usually about an 85% chance over their lifetime they'll develop breast cancer.
Let's say we don't have the gene. I mean, is there something we can, I mean, I
So
know that people say,
radical, right?
Yeah,
Wouldn't that
it's
be like
very
a
radical.
but they say like don't use like certain don't use deodorant, don't use this.
I don't believe that. So the things that you can do to reduce your risk of developing breast cancer, obviously to have your screening mammogram to catch it early, but to be your ideal body weight, to exercise, And those things will help decrease your risk of breast cancer.
Drinking wine, is that
Not
a good or a
Not the
bad?
bottle, not the glass of red wine.
But moderation is good.
Moderation.
So
No fast food.
not to take hormones. A lot of women who go through menopause will take hormone replacement therapy, and that can lead to an increased risk of breast cancer.
Really?
What about diet, red meat?
Yep, so to limit that.
Okay, because I just cut it right out now. Because I'm just a nervous Nelly, like I don't want it to come back.
So again, in moderation.
Okay.
You could have a hamburger every now and again.
And what about organic versus non?
So there's not a lot of great data for that.
I think our next guest is actually going to talk quite a bit about organic food and diet and nutrition. Yep. But no, this is so helpful. Thank you so much.
You're welcome.
And we appreciate it.
Thank you for sharing.
You're welcome.
Yeah, thank you for
so
being
excited
here
to have
with
you.
us.
We
Thank
know
you.
you're so busy.
And thank you for everything you've done for Cami.
Oh, yes. My pleasure.
Yes, thank you.
My pleasure.
You guys are amazing, so thank you.
Why not?
Okay, so you take one.
Yes.
Welcome back, everybody. In addition to staying healthy, being physically active, and getting regular screenings to help reduce our risks of breast cancer, we've learned more and more every year and every day about the link between nutrition, foods, carcinogens. Here to discuss them more with us tonight is our special guest, Marcy Spellman-Moreau. Welcome.
Hi.
Welcome,
Marcy.
Hi, Marcy.
To give a little background, so I've known Marcy for a very long time. Marcy's daughter Rachel is a pediatric cancer survivor, and Marcy's husband Michael recently passed away from breast cancer. Yep, you heard correctly, breast cancer, and as we heard from Dr. Birch, breast cancer does affect men. Marcy founded Time for Life, a nonprofit organization for children with cancer and family members. And once again, touched by cancer with her husband Michael, Marcy began to note the connection, as we talked about, between food and organic food and cancer diagnosis. And we're thrilled to have Marcy here. She recently launched a food label called the Naked Baking Ladies. You'll see the label on our screen right now. So welcome, Marcy. We're thrilled to have you here and
So
hear your
excited.
story about your food and your labels and everything. And we're so sorry to hear about
you.
Michael, but we're thrilled that you're here to talk more about
Thanks.
everything.
Yeah, it's a happy, sad story. I mean, happy tomorrow with my daughter Rachel actually is her anniversary of 26 years since her bone marrow transplant. So we get to celebrate life, and sad because unfortunately, you know, we weren't able to cure Michael with the medications and the treatments that are out there. So it was a tough summer, but a long journey, and I've learned a lot, and I have been able to, you know, in my journey when I founded Time for Life and I've worked with pediatric cancer patients, I learned a lot about the emotional effects of cancer, and then over the years I started to investigate a lot about the link between food and cancer, and not so much that certain foods are causing cancer, because a lot of people get so frightened and say, oh, if I eat that, am I going to get sick? But there are certain foods out there can help heal our body. And I don't mean every food that's considered now. We have superfoods can absolutely cure you, but they do some really great things. So what I wanted to do is develop a line of food products that actually use superfood ingredients. So we could go to the store and take one of my food products will be a marinara sauce. So we could take that sauce off the shelf, and in it will actually be components that are really good for you. So a lot of my food, I use turmeric root in it, which is amazing. I use specific herbs for you, and I know I have some turmeric root here. For some people that might not know what it looks like, we're fortunate. We're in West Hartford, and we have two Whole Foods.
Oh, well, Whole Foods and Trader
Two Whole
Joe's,
Foods.
right.
Yeah.
Trader Joe's, sometimes they have this. Actually, they can sometimes. But it's basically a root, and you peel it. It looks like a knobby carrot. This turmeric, there is a lot of research going on with this. It reduces inflammation. It does some really cool things to our cells. The process of apoptosis, which is basically cellular suicide. Our cells die. A lot of times they're just, that's the process. They're supposed to die, but cancer cells won't. So this will induce that. There's things that we can actually eat that can make us healthier, and along with exercise and an active lifestyle and doing things that are appropriate, I think we kind of limit our triggers, and that's all we can do, because in the midst of all this, we also need to enjoy life and live, and that's really important too.
So, but how would someone, do you just eat this?
So actually, yeah, you can. I mean, it
Like a
doesn't
carrot?
taste, it tastes very earthy, but I use it a lot. So in my foods, I start with what's called a mirepoix. And a mirepoix is, in French cooking, basically your base. And traditionally, it could be something like onions and garlic and celery, or celery, carrots, and depending on what you want to use. So I always use garlic and ginger and turmeric, and that's my base. That's what I start with in every one of my ingredients. So if you're making sauce at home, if you're making a salad dressing, if you're making soups, I throw this in everything. Now, one caveat is, unfortunately, you will have stained fingertips because it does stain. So watch your countertops. I mean, it turns things orange.
I've seen it in powdered forms. The powdered form is good. The dry form is good.
Personally, I like the root because now we're just not breaking it down. But the powdered form I use, and I just sprinkle it in as many things. Sometimes I make a turmeric tea if I think I'm feeling funky, and I'll just take hot water. It's not going to taste wonderful, but sometimes I might do that. But no, it's amazing, and we have it right here. And the line of foods that I have, I basically started with a couple sauces. So I have red sauces, and I have barbecue sauces, and one of the barbecue sauces will have blackberry and ginger in it. Just these little extra touches of foods that can help us stay healthier.
Right. Adding that extra little punch.
Exactly.
That's exciting to have a
it's
food
really
label.
exciting. It is, and hopefully production will happen. I did go through the organic certification process, and I personally think that's really important because it's pretty rigid. It's very rigid, and what it does is you can ensure when you're buying a food that's organic that the best quality ingredients are being used. We're not using genetically modified foods because you're not allowed to. And it's a very arduous process. It took me, I started in February, and my certification is forthcoming probably in the next week, but that's how long it takes.
Wow. So when do you think we'll see your label and your foods out?
By the holiday season.
Okay,
yeah,
Just in time.
Just
put
in
a little
time.
pasta basket together.
And
just in time for the holiday
season.
season.
Who's going to carry your stuff?
So I do have a website, and it's nakedbakingladies.com, and it will be posted on there. So I will be selling it online, and then what I'm doing is working with local stores, and I am hoping that it will be in Whole Foods in West Hartford at the very least, and some stores in the Massachusetts area. So right now, that's all to be determined in the next 2 weeks. So I really can't say that yet.
Okay. So we'll just keep
I
an
need to
eye
get
out.
there.
That's exciting.
In the next 2 weeks. Yeah.
Should have been
Keep an
ready
eye on
for
the website.
Halloween.
Yes,
For the trick-or-treaters.
I know.
So Dr. Birch, is this something like, do you think that more people are thinking like Marcy's thinking, organic, or, I mean, this is an education to me. I mean, and I was brought up very, Italian, so we don't really do fast food. We did a lot of organic, but like cooking this way, starting.
Absolutely, yeah. I think everyone is interested in being healthier, and I think we should eat real food, not processed food. We should eat things that grow from the ground, and then we eat them, and with the least amount of manipulation in between. And I think that is really the basis for how we should eat. We should eat plants, and we should eat things that rot. We shouldn't eat things that have chemicals in it. And I think that's the basis of being healthy.
And I've heard, like, when you're reading a food label, 5 ingredients or less. So if you can, if you're reading through your food label, like a good rule of thumb, 5 ingredients or less.
And mostly if you shop on the outside of the supermarket, you know,
that's a
everything
good point.
None of the aisles.
everything inside is processed. And
All boxes.
Yeah, and I think you should make it yourself. And I think, you know, that's how to eat. Mostly eat fruits and vegetables and grains and, you know, not anything, no white flour, and really dairy to have sparingly.
No chicken nuggets.
But that's a good point, make it yourself, because I think that's what I do. So I often have questions, well, what if you don't buy anything that's processed, what do you do for salad dressings or ketchup? And I say, I make it. And I know, and that's why I wanted to come up with this label, because I know sometimes it's not possible. We're all working, and we should be able to go to the store and grab something and trust that hey, you know, this is healthy, you know, this is good for me. There's a downside to that. It is quite the challenge to be the person that doesn't want to throw a lot of preservatives into a jar of sauce because it's going to cost a little bit more. It's a little bit trickier. You have to, you know, do some things that I know on my end. It makes it a little bit more challenging, but I honestly believe in it. You know, everything I've lived through and the story of my life, it's just a passion. So I'm, you know, intend to see it through. But you're right. It just kind of make your own food.
But I think women would pay a little bit more if, you know, I'm a working mom. I try to cook a lot on the weekends, but
it's not possible.
I can't do every, you know. So if I could go and buy something that's already pre-made, organic.
And I think there's a little more education people need to have about it, you know, because they think, you know, with pesticides, for example, on fruits, they think if they just wash it off, it's fine. And that's kind of an old school way of thinking. So I think the more we talk about it and the more, you know, we're, like you said, we're lucky to be in West Hartford to have 2 Whole Foods. I mean, some people travel quite a distance to come to Whole Foods. So that's great.
No, that's wonderful. Thank you so much, Marcy. And
Yes,
I know
Marcy,
that
thank you for coming and
joining us. Thank you for joining us, Marcy. To be here. No,
very inspiring.
Thank you.
And congratulations to your daughter.
Oh, thanks.
For her anniversary coming
up.
up.
It'll be a fun day tomorrow.
Nice to be able to celebrate.
It is.
And Dr. Birch, thank you for taking the time. We know you're so busy.
Thank you,
Really
Dr.
appreciate
Birch.
you coming.
Thank you.
Educating us all.
Yes.
So welcome back. And you know, with all this just great awareness, wonderful information, education, we think we want to mention some things that are going on, right, locally that you all can help with. I know Dr. Birch touched upon American Cancer Society and how, you know, she got some information from them, and they are just a huge, I mean, I think they're #1 aside from the federal government in, you know, research and programs. Right. So Making Strides in Bushnell Park, October 16th.
The walk, yep.
Is a walk, and it's all for breast cancer research. That one, though, I think it is American Cancer Society, and then there's a pink party in Bushnell. Blueback, and that is Susan G. Komen. Yep.
October
there's a few things.
October 6th. Yeah.
What else do
We're
we
going
have?
to post the list on our Facebook page. I know Marcy's doing a fundraising dinner in honor of Michael's research fund at Tufts University.
Yes.
We'll have everything posted on our Facebook page.
Yes, and then you might notice, just so I don't forget why I'm wearing this little pink streak in my hair. I am pretty funky, but the reason is
you are funky.
The actual reason is so this is for Cutout Cancer, a local group, and you can get this at Anita Lee Hair Salon in West Hartford, and the donation goes to Cutout Cancer.
And Cutout Cancer, what they do is the second Monday of every month, they provide complimentary services to anyone going through breast cancer, whether it's a massage or a facial at Milano's. And you'll have their website. Yep. Their website will be on our Facebook page. There's so many events. There's something that I think everybody can do really to help in the fight and to support someone who's going through breast cancer. And we could not end the show before we did a little celebration for Cammie. Oh. So we have, don't be shy. It's not like we have a stripper.
Are we having champagne or something?
But we have some little pink cupcakes.
How pretty is that?
So we'll share them with everybody before the end of the show. But I know you want to do your little toast.
And everybody enjoy.
So those are from Cake Gypsy. Yep.
Do something in support. That is amazing. And then Mario wanted to say a couple of things, or what's happening with your crazy costume? There's a party.
Every year I throw my Halloween party,
which is like a huge bash.
Big '80s freestyle.
You're inviting all of you.
It's on the 28th at the Portuguese Club in Hartford.
We'll be there.
Right.
We'll be there.
But it's in Newington.
It's in Newington, right? Which is
so fun. It's our neighbor. We'll come.
We'll be there. I'm not sure what we're going to wear.
It's big though, but yeah.
Awesome.
We won't be wearing the Bavarian costume.
No, we can't.
That's all me.
I think you should go as DJ Mario for Mom's Time Out. But
Bavarian costume. But
well, thank you so
much,
much,
everybody, and don't forget
you put the time in. Don't forget to take the time out.
Cheers.
Every night and you snuggle up real tight. Is it in front of your screen? Where everything we show is exactly how it seems. Everything we show is right for you. Everything we show is true, true, true. So get your drink and give us a wink, 'cause what you're watching is Mom's Time Out.